Hi, my name is Dale Absher. I'm a radiologist with Central Kentucky Radiology, and we are associated with Bluegrass Regional Imaging. February is Heart Awareness Month. Heart disease is the #1 cause of death in the United States and in the state of Kentucky. Heart disease is the buildup of plaque within our coronary arteries. This can cause numerous problems, not only death as the end result, but it can cause us to have decreased energy. Can cause our heart to beat different. People can have chest pain. You hear stories of people having chest pain or dying by shoveling snow. So it's very important. It's not just the end result of death, but there's a lot of debilitating issues that can occur. There are numerous risk factors for heart disease. Smoking, particularly in the state of Kentucky, is the #1 risk factor that we can decrease or get rid of. Other risk factors such as high blood pressure, high cholesterol, or diabetes are risk factors that we can control with either diet, lifestyle changes such as exercise, or medications that your healthcare provider may be able to give you. And then the one that we can't really change is genetics, or who our parents are. So in looking to prevent heart disease, there are numerous things that we can do. Diet and exercise are probably the two most common things that we can do. But we can also look at our risk factors and know what our risk factors are. Do we have high blood pressure? Do we need to change our diet? Do we have high cholesterol? At Bluegrass Regional Imaging, we offer a coronary calcium CT scan. That allows us to see whether there are calcifications build up in our coronary arteries. So a coronary calcium scan is simply a CT scan. It is done without contrast, does not require needles or any other drinking of contrast. The whole process from registration until the end of the exam is about 15 minutes. You simply lie on the table, a scan is obtained, and the computer generates a score based on the amount of calcification in your coronary arteries. If we know how much calcium we have in our coronary arteries, then our primary care providers can use that to help alleviate our risk. There are actually some medications that can reduce the amount of plaque disease in our coronary arteries. So it's simply another risk factor to look at, along with hypertension or blood pressure. We can look at calcium in our blood vessels. Heart disease is very important to me as well. I have a very strong family history of heart disease. My grandfather passed away when I was very young from heart disease and really didn't have the opportunity to know him. And my father had heart disease. And it's scary as a young child seeing your dad taken away in an ambulance, or it's scary sitting in the waiting room while your dad's having heart surgery and not knowing what's going to happen. So heart disease is very important. It touches all of us, not just the individual, but our families. Because of my family history, I decided to get a coronary calcium scan myself. I wanted to make sure that I was doing everything I could to prevent heart disease, because I didn't want my family to go through the same things that I experienced with my father and my grandfather. The results of the heart scan were positive, but that helped my physician and I to determine a health plan for myself. A diet change, more exercise, and things are working. So why choose Bluegrass Regional Imaging? We are an outpatient facility. We offer 3 convenient locations around Lexington. We offer clean, state-of-the-art facilities, and you have a choice. Bluegrass Regional Imaging offers a low-cost option compared to the hospitals. Our scans are cheaper. You receive 1 bill instead of 2 or 3 bills that you may receive at the hospital. So please keep in mind, when your physician orders a CT scan, you do have a choice. For more information about coronary calcium scans or other services offered by Bluegrass Regional Imaging, scan the QR code.